Welcome. This is a vodcast about the sport injury that is the Achilles tendon rupture, and I'm Claudia Matthews, your commentator for the duration of this video. The Achilles tendon, or the calcaneal tendon, is the largest tendon in the body, made up of tough fibrous tissue connecting the calf to the calcaneus heel bone. Damage to an Achilles tendon, particularly a rupture, means a complete tear, resulting in inability to walk, run, and jump. We rely upon our Achilles tendon to perform our daily tasks essential for regular function, most commonly seen within sports of American football, basketball, and soccer. To identify if an athlete has experienced an Achilles tendon rupture, the athlete will experience a pop in the back of the ankle and a gap develops in the tendon. One of the most identifiable ways to know if an athlete has suffered an Achilles tendon rupture is the sound. It resembles similarity to a whip or a gunshot. Looking at the image to see an identifiable difference within each ankle, the one circled red is an Achilles tendon rupture aftermath. Doctors during an examination use a method to identify an Achilles tendon rupture. This is to perform a Thompson test. The athlete lies face down with feet hanging off the edge of the table. The examiner squeezes the calf muscle, in specific the gastrocnemius. Thus doing this causes the contraction of an Achilles tendon, providing plantar flexion. The Achilles tendon will be ruptured if no flexion is performed by the athlete. MRIs, or magnetic resonance imaging, and ultrasounds are also recommended by the examiner to investigate further damage if necessary. Through classification, we can see that an Achilles tendon rupture will be a grade 3 soft tissue and chronic injury, meaning that most of the collagen fibre will have been ruptured and will not be able to tolerate loads. 80% fibre disruption and 10% of initial length. It is necessary to have a long rehabilitation due to the severity. Rehabilitation of an Achilles tendon rupture regards upon extensive physiotherapy and waiting periods between 6 to 8 weeks long, where 70% to 90% of athletes have successful comebacks after Achilles tendon ruptures. 3 to 5% do not continue after Achilles tendon ruptures. To avoid re-ruptures and to have a safe and full recovery, it is important for the athlete to avoid forceful, active, and passive range of motion of the Achilles for 10 to 12 weeks, aerobic, general, as well as cardiovascular conditioning throughout the process, as well as soft tissue treatments daily to ensure a proper recovery of the Achilles tendon rupture. Rehab exercises towards the Achilles tendon ruptures suggest upon extensive physiotherapy. Some of the exercises to get back to function and movement of the Achilles tendon regard ankle plantar flexion versus resistance. As shown in the image below and on the screen, the foot and ankle are held up towards the head and slowly moving the foot and ankle down against a resistance band. This strengthens the Achilles tendon and helps to provide motion. Another example of an exercise is a lunge stretch. As shown below and on the screen, hands are placed against the wall, placing the leg to be stretched in front of the body, slowly and gently moving the knee forward over the toes until feeling a mild stretch in the back of the calf or Achilles tendon. This also provides strength. As progression through rehabilitation, exercises can become more complicated and easier in management. Treatment to an Achilles tendon rupture. To repair a ruptured Achilles depends on age, activity level, and severity of the injury. Treatment provides two methods, of which surgical and non-surgical. Both options have the same complication rate at 19%. 70 to 90% of athletes have successful comebacks after an Achilles tendon rupture. However, 3 to 5% do not continue their given sport due to this injury. Non-surgical options include wearing a cast or a specialized Achilles tendon walking boot with a wedge to elevate the heel in order for repair. There are surgical options in which are required within about 25% of athletes with a complete Achilles tendon rupture. Surgery consists of an incision in the back of the lower leg and sews the two ends of the ruptured tendon and then is sutured closed. Both options consist to attend physiotherapy for further rehabilitation. Immobilization will occur during this period as recovery times vary between 6 to 8 weeks. Here is an example to which surgery is performed. Factors that can affect the risk of experiencing an Achilles tendon rupture to include Age. Within this, the peak age for an Achilles tendon rupture is between the ages of 30 and 40 years. Gender. We can see are 5 times more likely to see men experiencing an Achilles tendon rupture than females. This can be mainly due to their higher participation rates. Recreational sports. Achilles tendon ruptures are more common within running, jumping, and sudden starts and stops. Examples include basketball, tennis, and soccer. Steroid injections have been associated to weaken nearby tendons, resulting in greater risks of experiencing an Achilles tendon rupture. Anatomy of the lower leg counters from the Achilles tendon rupture, containing 2 major bones as the fibula and tibia. These bones hold the major mass of the body. The main muscles being the lower extremity of the leg is the gastrocnemius, in which is large and bulging-like, and the soleus, located deep into the gastrocnemius. The calcanean tendon, or the Achilles tendon, is to purpose the attachment of these muscles to the heel bone, calcaneus. Nerves running through the lower leg mainly being the sacral plexus, which provides motor and sensory nerve movement, as well as the tibialis anterior, located in between the shin bone. Gastrocnemius, consisting of fast-twitch muscle fibers useful for running and jumping in providing action to plantar flexion at ankle joint, and because it crosses the knee, it is also a flexor. The soleus consists of providing plantar flexors to the foot at the ankle joint. Cause of action. Toe taps. Touch, observe, talk, active, passive movement, and skill test. RISA. Rest, ice, compression, elevation, and referral. And finally, price. Protection, rest, ice, compression, and elevation. Using these techniques into evaluating an injury if you are a sports advisor on field, whether it be basketball, tennis, or soccer, as these are the most susceptible sports to an Achilles tendon rupture. Studies shown in Achilles tendon ruptures foreseen by Auckland City Hospital by Bruce C. Twaddle, revolving around early motion for Achilles tendon ruptures and is surgery important, comparing surgical and non-surgical options and how early motion enhances healing. The study was conducted and the study supported the early motion as an acceptable form of rehabilitation to both surgical and non-surgical options, at comparable function results and a low re-rupture rate. To conclude this Achilles tendon rupture vodcast, we have explored the injury and the analysis that comes with it. Thank you for listening, and I hope you enjoyed it and found it informative.